Thanks for staying with us here on World Now. Today, every 29th of September is marked World Heart Day, and as Nigeria joins its counterparts in marking the day, experts have identified significant gaps in awareness, diagnosis, and prevention of heart failure in the Middle East and Africa, while calling for an urgent action to be taken to stop the reverse, the steep rise in heart failure across these regions. The World Health Organization estimates that cardiovascular diseases kill 17.9 million people each year and account for 31% of all deaths worldwide. Hence, one needs to understand the various risk factors that could lead to heart-related diseases. Experts say heart failure is associated with significant morbidity and mortality and considerably impacts patients' quality of life, as well as incurring a substantial economic burden estimated at $1.92 billion, according to a group of regional experts as published in the Journal of the Saudi Heart Association. An average African may develop heart failure at the age of 53. They also identify diabetes, obesity, smoking, and a socioeconomic transition, high consumption of fatty foods as the main contributors to the higher prevalence of heart failure. Pediatric cardiologist Olawale Olabiyi joins me from the United States via Zoom. Thank you so much for joining us on World Now. This year's theme is...
Thank you for having me.
Right. This year's theme is Use Heart for Every Heart. This might sound a little confusing. Help us understand what this means.
Good afternoon. Thanks for having me on. Yeah, use heart for every heart. It just means use actually compassion and your heart to treat every heart. It comes from a place of caring, and that's where we can then use that to take care of everyone, and a place of actually taking care of one another, our neighbors, ourselves, using your heart to take care of every heart. It's a thing of everybody has to be involved in this, both locally, federally, and internationally. So using your heart to take care of everyone, because every heart counts, everybody counts. So it's not a thing where we can just ignore some people because of their socioeconomic status, but we're going to use our hearts to take care of every heart that's around us, from childhood all the way to adulthood.
So how important is the heart in the overall well-being of a person? And what are the activities or inactivity that people do world over that usually have negative impact on their hearts?
So the heart is essential in the care of everyone. It's the first organ that helps you in when you want to move, when you want to do things. It helps you in activity. It keeps you alive. It keeps you moving. And it's essential to take care of because you only have one heart. To develop heart failure and those things that come along with heart failure is a very big risk. It has high morbidity and mortality associated with that. So it's essential that we take care of our hearts from each individual, avoiding things like smoking, high alcohol intake, poor dietary intakes. We have to watch what we eat every day, avoiding things that have high carbohydrates, that are simple carbohydrates that the body burns off quickly and takes in quickly and then has a high sugar consumption, and then the body stores that as fat. So we have to watch what we eat every day and avoid the things that potentially can cause problems in the future. But the diet is essential in what we do in preventing heart disease. And then being mobile, being active, exercising daily.
We're swiftly running out of time, but very quickly. So if the heart is having some problems, some kind of problems, what exactly are the symptoms that one can actually always look out for? And what kind of emergency response that can be administered in the event of a cardiac arrest, for instance?
For the simple symptoms, if initially can be chest pain, difficulty breathing, shortness of breath. But if that becomes pressing and is urgent and you're having those pressing concerns, and you have more chest pain and it's unrelenting chest pain, you can try taking an aspirin and get into a hospital as soon as possible. In centers and areas where there's good emergency services, you can call for 911 to come for the emergency services to come get you. Over here in the U.S. is 911. But at least if you think you're having a cardiac episode, you can take an aspirin and then go to the hospital, and that can help to potentially save your life at that point in time.
Right. Well, thank you very kindly, Pediatric Cardiologist Olawale Olabiyi, joining us from the United States. Thank you so much.
Thank you for having me.